Alright guys, so I want to recap the third trimester testing for you. We finished off class today talking about the non-stress test, and I want to go through the oxytocin challenge test as well as AFI and biophysical profiles. So something to think about and why I have a question mark next to oxytocin challenge test is in all of my years in clinical practice, this test is still something that we need to learn and understand, but it doesn't actually get done because it involves giving the woman who is not in labor pitocin to see how the fetus responds to contractions. So it's one of those things that we don't do because we're iatrogenically potentially causing harm, but it is a test that NCLEX still tests on even though we don't see it in clinical practice. So I will review that for you. And at 36 weeks, we remember that every woman is going to have a vaginal swab. It's going to go into her vagina, this Q-tip, down her perineum and swab outside of the rectal area. And that is to detect if there is group B strep present. And if there is, we remember she's going to get penicillin in labor. So the non-stress test, again, for right now, what's important to remember is the definition of what a non-stress test is. Understanding that a baby that's less than 32 weeks, just neurologically and cardiac-wise, isn't going to have accelerations as high as a baby greater than 32 weeks. So we just define the criteria different. So it'd be 2 accelerations. They're going to be 10 seconds long by 10 beats above baseline in that 20 to 30 minute period. A non-reactive or non-reassuring NST would mean that the baby did not have those 2 accelerations, 15 beats above baseline for at least 50 seconds in a 20 to 40 minute period. We do, if the baby doesn't do this in 20 minutes, give it another 20 minutes. But those 2 accelerations have to occur in a 20-minute period. It can't be that one happens at 2 minutes and the other one happens at the 40-minute mark. They have to occur within a 20-minute span of each other. So this is what it looks like as the woman's having her non-stress test. We do these again in an office setting. Patient can be in her own clothes. We just put the belts on her belly. This woman has a button because she's pushing every time she feels fetal movement, and that's just registering on the strip. I show you this. This is a reactive non-stress test. We will learn how to read them on Thursday in class. So a reactive NST, which is a positive finding. That's a good thing. So you can see I'll circle here the accelerations that are counting in this 20-minute period. The other thing we look at is the bottom. This is her contraction pattern, and I would say that there's no regular contractions. There's what we call some irritability down here. Again, we'll learn how to read these, meaning her uterus isn't quiet, but I don't see full-blown contractions. But this fetus is well oxygenated, well perfused based on the result of a reactive non-stress test. Another reactive test. This is showing you just an example of an acceleration. And this is what I was talking about the oxytocin challenge test. So this woman comes in and is given IV pitocin, and the pitocin is increased until she's contracting at least 3 contractions in 10-minute spans. The way that the language is about an oxytocin challenge test is that if it is a negative test, it means that it is a normal reassuring finding. I'll repeat that again. A negative oxytocin challenge test is a normal reassuring finding. It means that she didn't have any late decelerations with those contractions. Late decelerations are a bad finding. So you can now think of it this way. A positive oxytocin challenge test is abnormal. That is incredibly non-reassuring. That means she'll likely be delivered because the fetus is not tolerating contractions and will not be able to tolerate labor. So we will go through what each of these decels mean on Thursday, but to set the stage, a late decel is when there is a utero-placental insufficiency. You can break that apart, right? Uterus to placenta is insufficiently passing blood, which means the baby is not going to be getting enough nutrient and oxygen. And these strips I left in here because I want to show you an example of a late decel, and these will be good reference after Thursday's class for you guys to go back and practice how to read strips. I left these in here as practice for you. This is an example of a late decel. So we look at the contraction and the decels occurring after it. I will teach you exactly how we determine that based on a set criteria, but just setting the stage with an image for right now. Again, these are all here. They're various decels being represented for you to go and use. Everyone always wants more strips to practice on. So these will be good practice leading up to the next exam. And the biophysical profile, what we'll often do is if a patient has a non-stress test and it is non-reactive, meaning it was non-reassuring, that patient did not have those 2 accelerations in the 20-minute span, what we'll do is not deliver the patient, but send her for an ultrasound to get another idea of exactly what's going on with that fetus. So a biophysical profile you can get up to 10 points for, so you get a 2 for each of these categories. So the patient either comes in with a 2 or a 0 based on did she have a reactive NST. If she did, she gets 2 points. If she didn't, it's a 0 there. So then what we look at on the ultrasound is look for breathing movements out of that baby. On ultrasound, is the baby grossly moving? So meaning, is it just moving? What's the muscle tone like? So you can think of APGARs for this. Is the baby nice and flexed? Or is it limp looking? Limp would be the bad finding. And then we measure how much amniotic fluid is there, and we like it to be above 5 centimeters of fluid. So for all these things, she's either going to get a 2 or a 0. When we have a biophysical profile, the patient comes back, had their non-stress test, and it was non-reactive. If they come out of their bio and it's an 8 out of 10, we're reassured that fetus is okay. Once it drops below that 8 out of 10, we're going to be sending her to the hospital to get more information about what might be occurring with that baby. There have been times, guys, if a biophysical is done and the result is a 2, we're running that patient over and we're stat sectioning her. There's something going on if a baby is a 2 on this test. Fetal movement counts is a really reassuring way for any pregnant woman to just ensure that her baby is moving the way it should. So what I have women do is, preferably after they've eaten, so then they have some sugar and then the baby's likely to move, I have them sit down, put their hands on their belly, and they should feel 10 movements in an hour. Now, if she feels 10 movements in the first 10-15 minutes, she's done, but it needs to be 10 movements in an hour, and that's a sign of that's reassuring for that fetus. And then I want you to jot down after this material what you think should be offered to Peg and Michelle, and what we will do after our quiz before we dive into reading strips. We will go ahead and we will put these 2 cases together after our quiz. That being said, I know you're studying for the quiz, but please, please, please make sure you watch the 10-minute pre-assignment so that we really can have just as strong of a class as we had today. I appreciate all the effort you guys put in for today. It made a really strong class.